Hello, and welcome to your orientation. I'm Diana, the Shadow Health Preceptor. I'm here to teach you how to navigate the digital clinical experience. This orientation will show you how to interact with your digital learning environment, where you will examine simulated patients. At each step, I will tell you what to do to continue. To continue, click Start. Before we begin, it is important to know that your progress is constantly saved as long as you are connected to the Internet. You do not need to save your work manually. To take a break, simply close your browser window or log out. To return, log back in and continue your last attempt. Shadow Health assignments require you to listen to sounds. For example, the respiratory exam simulates breath sounds as heard through a stethoscope. To conduct each simulated patient exam, you will need a computer. If you need assistance, every patient exam has instructions to guide your assessment of the patient. Let's view sample instructions now. To continue, click the Instructions button and review the instructions. To close the window, click the Instructions button again. These simulated patients are unique because you can communicate with them by typing questions and statements in the communication box. Tina Jones has volunteered to help us during this orientation. To continue, click in the communication box. Type a greeting to Tina, such as, "Hello, my name is," your name, "and I'm here to interview and examine you." Use Return on your keyboard or click Submit on the communication box. Click Next.
Hey.
When you begin an exam, always greet your patient first. The communication box allows you to communicate with a patient in 3 other ways: ask, educate, and empathize. You will primarily use the ask mode during an interview, which is the default state of the communication box. To continue, click Next. Educate mode lets you provide patient education when appropriate. For instance, a patient may need to learn why it's important to manage high cholesterol. To continue, click the Educate tab. Type an educational statement such as, "Treating high cholesterol helps lower your risk of stroke." Use Return on your keyboard or click Submit on the communication box. Click Next. Empathize mode lets you respond with empathetic statements if a patient is discussing a troubling topic or expresses discomfort. For instance, a patient may discuss the loss of a loved one. To continue, click the Empathize tab. Type an empathetic statement such as, "It sounds like that was a challenging time for you." Use Return on your keyboard or click Submit on the communication box. Click Next.
Thanks for
Simulated
telling me.
patients can understand most questions humans can, but there are a few principles to communicate with them effectively. 1. Type questions using correct spelling and grammar. 2. Make your questions specific and avoid pronouns. For example, he, they, her, it, that, this. 3. Avoid compound questions. If you need a reminder of the communication tips, you can access the Talking Tutorial. The Talking Tutorial is available during every patient exam and can be started by clicking the question mark. The exam menu on the left is where you will access procedures. The tests and tools in this menu relate to the body system you are examining. I'll show you how to use the pen light. To continue, follow the flashing exam menu buttons to select the pen light. Click Next. After conducting each test and tool, report what you observe. Select No Visible Abnormal Findings in the Objective Data tab, and then click Next. Let's try a more complex procedure. Remember, this orientation introduces you to elements you will see in a simulated patient exam, so we will not be following the same order you would in a normal exam. To continue, select Respiratory Percussion in the exam menu. Click Next. A full respiratory percussion requires you to percuss the posterior of the patient. To percuss Tina's back, follow the instructions below. To continue, click the rotate arrow on the side of the body map. Click an exam point. Click Next. Your objective data collection skills will be assessed on the accuracy of the findings you report, so be sure to complete each relevant section of the Objective Data tab during your physical examination. Select All Areas Resonant and No Areas of Dullness in the Objective Data tab, and then click Next. This is a good opportunity to talk about tool tips. If you need help with a procedure, click the question mark button in the upper left corner of the body map. Everything you do in an exam appears in the transcript. Both you and your instructor can review this record of everything you do, ask, and state in a patient exam. Expand the transcript by clicking the arrow next to it. When your transcript gets longer, you may scroll up and down to view more. On the right side of the page is the electronic health record. As with real-life exams, documentation is critical. Use the provided sections of the EHR to document findings throughout each patient exam. Keep in mind that once you end the exam, you will not be able to record any additional documentation. When you're finished with an exam, click the End Exam button on the exam menu. A confirmation screen will appear, allowing you to finalize your documentation. Be sure to finish your interview, procedures, and documentation before ending the exam. You may practice now without leaving this orientation. Remember, your progress is saved constantly. To continue, click End Exam in the exam menu. Click Continue. Click Next. After you completed the Shadow Health orientation, and we've covered a lot. Remember, the Help Desk link at the top of the page will connect you with any support you may need. Good luck! Hi, I'm Preceptor Diana. Good choice. This question has open, neutral construction and allows the patient to emphasize any concerns in her own words. Good choice. This is a quantifying question because it begins with when and asks the patient to provide specific numerical detail. Good choice. This question can This question is not an open question. It is a yes or no question. Choose the open question in this list. Good Good choice. This is a broad open question, and so it's a great way to begin a patient interview because it allows the patient to prioritize her own concerns while you listen. Hello. I'm here for my physical. No, I don't have any health problems. I never really have. I almost never get like a cold, and I've never been in the hospital. I've never even broken a bone.
Oh, I don't take any medications. I mean, unless you count ibuprofen every so often. I don't take any vitamins, supplements, anything like that. I only take Advil once a month. I don't have any prescriptions. Yeah, I take Advil for cramps. My period, that time of the month, whatever you want to call it. I take 2 at a time, like it says on the bottle. And I only take them once or twice. On the first day of my period, that's the only day I have cramps. I don't know how many milligrams. It's not extra strength or anything. I think it's just kind of regular Advil. Two weeks ago, that's the last time I got my period. Yeah, I'm allergic to peanuts. Well, when I've eaten peanuts, the inside of my mouth and inside my throat gets pretty itchy. It's weird. But I don't think I've ever had hives or anything like that. No, I'm not allergic to anything besides peanuts. At least that I know of. No, I don't get hay fever or sneezy around flowers or anything. Lucky for my mom, since she makes me help her in the garden all the time. The last time, my mom took me to our doctor and they told me to take Benadryl because it was a mild reaction. It just went away after a couple of hours. Well, I ask what's in things, especially if something's fried, because it could be fried in peanut oil. And I read ingredients before I buy something if I'm not sure. No, I don't think I've ever had a breathing problem. Like my friend who has asthma, she's always using an inhaler. I don't deal with anything like that. I first found out I couldn't eat peanuts when I was 4. Nope, no other food allergies. No, it's never been that bad. No, I'm not allergic to any medications that I know of. No, I've never had to. My allergic reactions aren't really the kind that need that. Latex allergy? No, I've never had that. Yeah, well, I have. I've had like 3 cigarettes ever. It wasn't a big deal. When I smoked, I wasn't trying to impress anyone. I mean, maybe I did want to fit in, but mostly I was just curious. My friends didn't like make me do it. I definitely don't want you to think that. I've had like 3 cigarettes ever. It wasn't a big deal. I've had like 3 cigarettes ever. It wasn't a big deal. No, I really haven't done any kind of drug, I swear. Nah, I'm not really interested in that. I guess I feel kind of embarrassed that I smoked because I know all the bad stuff it does. Cancer, emphysema, all of that. It wasn't even enjoyable, really. Definitely not. I've smoked a few times, yeah, but honestly, thinking about doing it again makes me feel sick. When I smoked, I wasn't trying to impress anyone. I mean, maybe I did want to fit in, but mostly I was just curious. My friends didn't make me do it. I definitely don't want you to think that. No, I haven't tried that.
The purpose of this video is to teach you about subjective and objective data collection and how to properly document within the Shadow Health assignments. Making sure that all documentation is complete, correct, and timely is an important responsibility of being a practicing nurse. But just to be clear, we will be practicing documentation which is not a part of your DCE score, but may be graded by your instructor. The way we are going to practice narrative style documentation in this video is how we recommend you work within our assignments. You should always follow your instructor's directions on documentation. Let's go ahead and go over some best practices before we dive into our patient case. These recommendations are available to review as an attachment on this assignment. Here's some things you should do while documenting. Number 1, before entering anything, ensure that the correct chart is being used. Number 2, always use complete descriptions. For example, don't chart a symptom such as the patient states that he has pain without also charting how it was treated. Number 3, record precautions or preventative measures used, such as bed rails. Number 4, document any phone call to a healthcare provider, including the exact time, message, and response. Number 5, if a patient refuses to allow a treatment or to take a medication, document it along with their reasoning and be sure to report it to a manager and the patient's healthcare provider. Next, always chart patient care at the time you provided it. It is too easy to forget details later on. And finally, always document often enough and with enough detail to tell the entire story. Next, let's go over a few don'ts, a few things that you should avoid doing. Number 1, don't use shorthand or abbreviations that are not widely accepted. Number 2, don't write imprecise descriptions such as the bed was soaked or a large amount. Number 3, never chart what someone else said, heard, felt, or experienced unless the information is critical. If absolutely needed, use quotations and properly attribute the remarks. And finally, never chart care ahead of time, as situations often change and charting care that has not been performed is considered a fraud. Let's go ahead and get started with our case. We will be going through, asking questions, performing a physical exam, and documenting using our best practices along the way. Our patient in this case is Ed Carter, a 65-year-old African-American man who has been admitted to Shadow General Hospital for back pain, blood in his urine, and increased urinary frequency. We will begin eliciting and documenting all of the subjective information. Subjective data is information that you receive from the patient or from one of his or her knowledgeable companions. It is what you are able to pull from the patient during the interview and includes things like how they're feeling, what their symptoms are, or what their current conditions are. I always like to start by establishing the chief complaint. It is important that it is in the client's own words. The chief complaint is basically why the client is seeking care. In order to elicit the response you're looking for, you should start with an open-ended question, something like this. What brings you to the hospital today?
I had this terrible pain in my back, and this morning I think it was blood in my urine. It was a pink color. I could tell something serious was going on.
All right, we need to get a timeline on the chief complaint before we can document it, so we need to ask just one more question. How long has this been going on?
The pain first started 3 days ago. It was more subtle then and built up over the past few days.
All right, now we can go into the nursing note and document the chief complaint. So we click on nursing admitting note. And then I am a big fan of headings in my documentation. So I would just write something like chief complaint, and then colon. And then I would put it in quotes, signifying that this is the patient telling me why he has decided to seek care. And then I would say something like back pain for 3 days and dark colored urine this morning. All right, we are also going to note the reliability of the source. Sometimes our patients are not able to give us the full picture of their complaint. This can be for a variety of reasons, whether that's poor memory, poor organization, or mental illness, or many other things. That should all be noted here in the beginning of your documentation so the reader can understand the reliability of the subjective information. In our case, so far, our patient seems to be a reliable historian, so that will be the next thing I document. So I'll come down here and write source. And then I can also use the speech-to-text feature here, which I'm going to do intermittently throughout the documentation. Information obtained from the patient who appears to be a reliable source. The next section we can move on to is the history of present illness. We generally start this note with the history that we have pulled from the chart and also verified with the patient. So I'm going to go through and ask some of those verifying questions. Do you have a history of hypertension?
Yes, I've been diagnosed with high blood pressure.
Do you have a history of chronic kidney disease?
Yes, I've been diagnosed with chronic kidney disease.
Do you have a history of atrial fibrillation?
Yes, I've been diagnosed with atrial fib.
All right, so now that we have verified a little bit of his history, we can come over and start documenting our history of present illness. I'm going to come back to my nursing admitting note, and the abbreviation for history of present illness is HPI. So I'm going to start there, and then I'm going to dictate a little bit of my note here. Mr. Carter is a 65-year-old African-American male with a history of CKD, HTN, and atrial fibrillation who presents to the ER today with complaints of back pain for 3 days and blood in his urine for 1 day. All right, so then we can move on. We need to qualify each of those symptoms using the old CARTS acronym, which is onset, location, duration, characteristics, aggravating factors, relieving factors, treatments, and severity, to ensure that we have a firm grasp on his symptoms and we aggravating factors, relieving factors, treatments, and severity, to ensure that we have a firm grasp on his symptoms and we know how he's feeling. So let's go ahead and start with pain. We've already asked about the onset, so let's continue qualifying the symptoms by asking about location. Where is your pain located?
In my lower back on the left side.
Is the pain constant?
Yes, once the pain started, it just kept increasing until I came to the ER.
What does the pain feel like?
Just terrible, sharp, almost like a shooting pain, very intense.
What makes the pain worse?
The only pattern I noticed with this pain is that it started out as a slight backache and gradually got worse until I had to come to the ER. I'm not sure what made it worse. It seems like the kidney stone determined that.
Does anything help the pain?
I didn't take anything for the pain at home. I thought it would pass. Until this morning, that is, when it got unbearable. The pain medication I got in the ER has helped.
Can you rate your current level of pain on a scale from 0 to 10?
Right now, it's 2. Thank God for the medication.
Can you rate your pain when you came into the ED?
For the medication, it was a 9. Very painful.
We now have enough information to go back into our note and finish up our HPI before we move on. So I am going to dictate this. The patient reports the pain as being localized to his left lower back, period. He reports that his pain has gotten increasingly more severe since this morning, and he has noticed a pink color to his urine, period. He describes the pain as sharp and coming and going. He states that nothing makes the pain better or worse, and he tried no treatments at home for the pain, period. He reports that he presented to the emergency department today due to worsening pain, period. Upon arrival to the ED, he reports a pain level of 9 out of 10 and describes it as severe, sharp, and stabbing, period. He reports that the pain causes him to lose his appetite, period. He denies any nausea, vomiting, weight loss, or fatigue, period. All right, so that will round out our history of present illness, and then we will move on to past medical histories. And then we will move on to past medical history. So I am going to go ahead and put that heading here. PMH is the abbreviation. And then we know that Mr. Carter has hypertension, he has chronic kidney disease, and he has atrial fibrillation. So we're going to have to go back in, ask him a few questions to clarify when he was diagnosed with each of those things, and then we can come back and chart them. When were you diagnosed with hypertension?
I was 55. That was 10 years ago.
When were you diagnosed with chronic kidney disease?
I was 62. I've known about my kidneys for 3 years.
When were you diagnosed with atrial fibrillation?
I was 61 when I got that diagnosis, 4 years ago.
All right, let's go ahead and document them. We'll come back over to our chart. I prefer to come down and have each category be on its own line. So we'll start with hypertension. Since age 55. Next would be the chronic kidney disease. And that is, let's put stage 2. Be as specific as we can here. And then since age 62. And finally, AFib since age 61. And if you ever need to go back and look for that information, maybe you forgot which age he said, you can always come in and expand the chart and check out your last couple of questions and chart it more that way. Now we can go ahead and go through and ask him some questions about allergies, because that is the next area that we will need to document. Do you have any allergies to medications?
No.
Do you have any environmental allergies?
No, I don't have any allergies like that.
All right, so he is denying any allergies, so we can go ahead and document that. Again, I like to make a heading. And then we can just note that he has no known allergies, and then we can move on to home medications. We need to go ahead and verify every single medication that is reported in the electronic health record, along with the last dose he reports taking. So you can go into orders and then scroll down to the bottom, and it will show you home medications. So warfarin, verapamil, and hydrochlorothiazide are all of his home medications. So those are the ones we're going to have to verify. We'll ask about each one and ask about when he took his last dose. In the interest of time, we will go through just the first medication, but please note that when you're doing this on your own, you do need to go through each one. So let's go back to the nursing note, and then we will start asking questions. I'm just going to ask him a couple questions about his warfarin. What anticoagulant are you taking?
Warfarin.
What is the dosage of your warfarin?
My doctor got me on 2.5 milligrams.
How often are you taking the warfarin?
Once a day.
Do you have any side effects from the warfarin?
I handle it fine. I haven't noticed any ill effects.
When is the last time you took warfarin?
No, I usually take my meds in the morning, but I didn't get a chance to take anything yet since I came to the ER.
All right, now we have that information. We can go in and document. So I will make my heading. I'm going to call this one home medications. Warfarin, 2.5 milligrams. 1 tablet by mouth for irregular heart rate. And he is telling us last dose was yesterday. All right, we can go ahead and move on. Again, just remember that you would go through each of those medications. Just for the interest of time, we're going to do one as an example. There are many diseases that have a familial link, so it's very important to take a focused family history. This will give you a clear picture of risk factors and familial tendencies. Specifically in this case, a tendency toward heart and kidney disease can cluster in families. In the history, in this specific case, we are looking for familial linked high blood pressure, atrial fibrillation, kidney stones, and chronic kidney disease. So let's go ahead and ask a few of those questions. Do you have a family history of high blood pressure?
Now, that's something I know my mother and father both had.
Do you have a family history of atrial fibrillation?
No atrial fibrillation in the family.
Do you have a family history of kidney stones?
No, I suppose this is a family first.
Do you have a family history of chronic kidney disease?
I don't think anyone had kidney problems before me that I know of.
All right, so now we know the answer to those questions. Let's come down and make our heading for family history. And now we can record what he's told us. So mother and father both had hypertension. And then we will go ahead and record the negatives here. So no known family history of chronic kidney disease, kidney stones, or atrial fibrillation. All right, so there's the concentrated family history in this case. We can go ahead and move on to the social history next. A social history covers many areas of your patient's life that relate to his or her health, such as educational level, employment, support network, and living situation, among other things. The purpose of this type of assessment is to collect information to give the clinician a clear picture of the individual and aid in determining treatment. In this case, we need just a targeted social history, and that would include questions about substance abuse, activities of daily living, and because of Mr. Carter's age, we would ask about elder abuse and assess his risk factors. In the interest of time, we were only going to ask a couple of the basic questions and then discuss substance abuse and document it. What do you do for a living?
Well, I was a pilot before I retired.
Are you married?
I've been married to my wife, Cynthia, for 42 years.
Do you smoke cigarettes?
No, never.
How many times a week do you drink alcohol?
I don't drink every week. I don't even drink every month.
Do you use illicit drugs?
No, I never once tried drugs.
Okay, let's go ahead and start to document that. So we're going to make our heading, social history, and we can start with employment. Mr. Carter is a retired pilot. Next, we will go to marital status. Mr. Carter is married. Next, we will talk about tobacco use. He denies past or present tobacco use. Next, we will go to alcohol and drugs. He denies any illicit drug use. He denies alcohol use. All right, there we go. That is our brief social history that pertains to the problem. And we will go ahead and move on to the review of systems next. Review of systems is our final section here. It is a series of questions asked by healthcare providers, and it helps us get a complete picture of the patient's medical history. It is often structured as a component of an admission note covering the organ systems with a focus upon the subjective symptoms that the patient is experiencing. In this case, the focus would be on general health and the respiratory, cardiovascular, gastrointestinal, and neurological systems. We will go through the category on general health and then just practice documenting it. Let's go ahead and ask those questions. Do you feel feverish?
No.
Do you have the chills?
No chill.
Have you experienced night sweats?
No.
Are you fatigued?
I'm tired now because I didn't sleep well last night. I usually have a lot of energy.
How is your sleep?
Typically, I get a full 8 hours. Last night was an exception. I tossed and turned because of my back pain.
Do you have swelling anywhere?
No, I haven't noticed any swelling.
Has your weight changed?
No, my weight is pretty darn stable.
All right, let's come on over and document our review of systems. So I'm going to be pretty specific here in my title since this is not an admission note and we did not go through the entire review of systems. It was just a targeted review. So I am going to say review of systems significant to chief complaint as my title. And then I am going to make it general. Scroll down so you can see. All right, and then it's going to be negative for fever, chills, night sweats, fatigue, and purposeful weight changes. All right, there we go. Oh, we can just say -4. All right, there you go. Now you can see it's important to review your note and your documentation before you submit it. And that really concludes the subjective portion of our assessment. Next, we can move on to the documentation of our objective assessment. In this assessment, there is not a specific place to document our objective data in a narrative style, since you're not really asked to document the objective data narratively here with Mr. Carter. In some shadow health cases, there will be. But in this case, we can just make a different heading within the subjective data box. So I'm just going to come down and say objective here, and then we can go from there. Objective data is observable, measurable information, such as vital signs and your physical assessment. It is important to be able to distinguish between subjective and objective data when you are documenting. For example, the symptoms that a patient is reporting to you is considered subjective data and should be documented under the subjective data heading. Well, a sign is an objective finding related to the associated symptom reported by the patient. This can sometimes feel a little difficult to understand, so let's go through an example and distinguish between what is subjective and what is objective. If you are a nurse caring for a patient who complains of stomach pain, this is a symptom and is documented under the subjective heading. In contrast, you are assessing a patient and you determine that their abdomen is tender to palpation. Now that is an objective sign, and it should be documented under the objective heading. Let's go through one exam action and practice documenting it so you get the idea. I'm going to go ahead and click on Assess Output, and then Urine Quality. The important thing for us to note is the color and clarity of the urine. In this case, I would go back to my narrative style note and my objective heading, and then I would say, urine is clear, no sediment noted, light pink in color. And then I would add, total volume is approximately 510 mLs. Proper documentation is an essential skill to have as a healthcare provider. It is the record of nursing care that is planned and delivered by nurses. It is the principal clinical information source to meet legal and professional requirements. Clear, accurate, and accessible documentation is an essential element of safe, quality, evidence-based nursing practice. I hope this tutorial has helped you understand what needs to be included and how to best organize your documentation within the Shadow General Hospital system. Communication breakdown is one of the main causes of adverse clinical events, and we as care providers regularly convey patient information to other healthcare professionals. Many clinical sites implement a communication protocol called an SBAR handoff to ensure we communicate all the critical pieces of information to other care providers. Using the SBAR technique, the provider gives the situation, background, assessment, and their recommendation. In Shadow Health, you will have the opportunity to practice handing off patient care using the SBAR method. In this video, we will go through each SBAR step and discuss best practices for effective communication. First, let's start with what begins prior to calling the advanced practice provider or handing off care to another RN. Good communication begins with you having all of the information organized and all of the proper resources prepared prior to initiating contact. Here are a few things that you may ask yourself to help prepare. Number 1, have I seen and assessed the patient myself before calling, or am I just hearing something from another nurse or a medical assistant? Number 2, do I need to discuss the situation with a resource nurse or a preceptor prior to contacting the advanced practice provider? Number 3, do I know the admitting diagnosis and the date of admission? This may be asked of you during the phone call. Number 4, have I read the most recent provider progress notes and notes from the nurse who worked the shift ahead of me? This will make sure that you have a firm handle on the situation. And finally, do I have available the following when speaking with the provider in case there is a question? I would suggest having the patient chart, the list of current medications, allergies, IV fluids, and labs, most recent vital signs, and the patient's code status. At the conclusion of some of the Shadow Health patient encounters, you will be met by your preceptor who you will be handing off care to. In this example, we will be conducting our SBAR handoff of a post-operative patient to preceptor Diana. He is a stable patient who we have just taken care of for several hours. The goal of this handoff is to safely transfer care of this patient to preceptor Diana. The first step in the communication process is letting the provider you are contacting know what the situation is, or telling them concisely who you are, what your role in the healthcare team is, and who the patient is that you're contacting them about. You're not going to just launch straight into the problem. You're going to give them all of the necessary information to understand who you are and which patient you're talking about, and a brief statement about what the problem is before getting into anything specific or asking any questions. In our example, I would say something like this. Hi, this is Julie, and I am the nurse caring for John Larson in room 302. He is a 46-year-old male who is post-op day 1 from his total knee arthroplasty. I am ready to transfer him back into your care. Next, we move into the background. What is the background information? This step includes a brief synopsis of the pertinent information related to the situation. Remember that pertinent information would include any history of drug allergies if part of your recommendation includes medication as an intervention, as well as any medical, social, or family history that would have an impact on the recommendation you are providing. In our example scenario, because I am handing off care and not asking for an intervention, I am basically just giving a concise overview of the patient, as well as the 2 main issues that I dealt with today, which would be his incision and pain management. Mr. Larson was admitted yesterday following his left knee arthroplasty due to osteoarthritis. He has a history of hypertension and hyperlipidemia and takes lisinopril 10 milligrams daily and atrovastin 20 milligrams daily. He is allergic to codeine. He was experiencing pain level of 4 out of 10 when I saw him for his morning care. He had a dose of oxycodone acetaminophen 325 milligrams, 1 tablet, 1 hour prior. I performed an assessment of his surgical wound and his dressing is dry and intact. There is minimal bloody drainage in his knee drain.
What is your assessment of the patient's condition?
Next, we move to the assessment. This is the next step where you will then discuss what the problem is. What is your analysis? What have you seen? What have you found? Or what do you think of the situation? In this scenario, I would discuss the patient's postoperative pain. This is the most important problem that this patient is experiencing, and it will continue to need to be addressed after I've handed off care. So I would say something like, Mr. Larson is experiencing expected postoperative pain and discomfort.
What would you recommend I do to care for the patient?
The final step is recommendation. This is where you will discuss how you think the problem should be corrected. You will discuss the action that you are requesting or your recommendation for what should be done as a resolution to the problem. In this scenario, we discussed the fact that Mr. Larson's exam findings are as you'd expect for a man experiencing a knee arthroplasty. We are not worried about him having unexpected bleeding or his surgical incision. What Preceptor Diana needs to be most on top of while caring for Mr. Larson is his pain. It seems like the pain medication is working as it should, so no increase or decrease is necessary. So I would say something like, I recommend continued postoperative education on rest, mobility, and comfort. The SBAR technique provides a framework for communication between members of the healthcare team and is essential for fostering a culture of patient safety. It is an easy-to-use, concrete mechanism that helps to streamline communication and allows for an easy and focused way to set expectations for what will be communicated between members of the team. As you go through and practice, I hope you will find that this tutorial helps you organize your thoughts as you are relaying patient information. my name is Julie Byrne, and I'm a peer consultant for Shadow Health. I'm also a nurse practitioner and a nurse educator. I believe that you can learn a lot from interviewing and assessing these virtual patients, and today I'm going to walk you through a complete health history. First, I'd like you to understand a little bit about our patients. These assignments are learning tools, and they're designed to allow you the luxury of time to practice. So when your time is limited, you will be able to perform a high-quality, time-effective assessment. The patient exams will often take you over an hour to complete. Some students get caught up thinking about the length of time that the exam takes and forget that it's a learning tool. Okay, let's get started with the assignment. We can begin by understanding the importance of a thorough health history. A health history is a record of information about a person's health, and is compiled by doing a thorough interview. It includes information about allergies, past and current illnesses, surgeries, immunizations, and a family and social history. It also includes information about medication and health habits, such as diet and exercise. Let's greet our patient and start with the interview. You should greet your patients by using Mr., Ms., or Mrs. and their last name. You should also tell them what your name is and what your role in their care will be. Hi, Ms. Jones. My name is Julie Byrne, and I will be your nurse for today.
Hello.
Let's start by getting an understanding of the history of present illness. The history of present illness, or HPI, is important because it allows you to understand why the patient is seeking care. In general, it is a detailed chronological description of the development and progression of the patient's present illness from the first sign and symptom to present. I always like to start with open-ended questions. It allows the patient to tell you what their understanding of their current situation is. So for example, instead of saying, "So I hear you have a wound on your foot," to which the patient would likely just reply yes, asking in an open-ended way allows your patients to give whatever information that they feel is important. So instead of saying that, I would just say, "What brings you to the hospital today?"
I got this scrape on my foot a while ago, and I thought it would heal up on its own, but now it's looking pretty nasty, and the pain is killing me.
Ms. Jones is telling us that she's in pain. This is a great time to practice empathizing with her. I'm going to select the Empathize tab and then make an empathetic statement. This helps to build rapport and trust with the patient. It is important to note that these statements will be a part of the overall picture of your interaction with our patients when looking at your results. When you are using the education and empathy features, it's important to note that you are not graded on the exact words you use to educate or empathize, but rather you are assessed on the timing of your response. I would not earn the point if I moved on in my interview and asked a couple more questions and then remembered to come back and empathize with Tina. You should offer education and empathy immediately after it's warranted. I'm sorry you're in so much pain. I'm glad you're here so we can help you.
I appreciate that.
Let's move on to get more information about Ms. Jones' foot. We are going to begin to qualify her symptoms and get more information on her injury. I like to use the Old Carts acronym as a reminder of what to ask. So that's OLDCARTS. O is for onset, L location, D duration, C characteristics, A aggravating factors, R relieving factors, T treatments, and S for severity. I think you get the idea. You would continue to get all of the information necessary to give you the entire picture of the current situation. So for example, we would ask, when did the pain start?
Well, I got the scrape a week ago, but the scrape and the pain got a lot worse in the last few days.
Where is your wound?
It's on the ball of my foot.
Can you rate your pain on a scale of 0 to 10?
Like a 7. It hurts a lot, but whatever pain med the ER gave me is helping a little bit.
All right, now sometimes our patients aren't going to immediately understand what you're trying to say. And like a real patient in your clinical work, you may need to rephrase so they understand. So let's go back to our last question we asked about pain. So if I said something instead like, rate it 0 to 10. The patient's not going to understand, so you can read through the 4 statements. These are clarifying statements, and decide if you can rephrase to one of the questions offered. You can see that we could choose this one or maybe even a couple of the other ones, but I'm going to go ahead and choose the second one.
Like a 7. It hurts a lot, but whatever pain med the ER gave me is helping a little bit.
And you see we get the same answer. So just a couple more things. Additionally, the virtual patients may struggle to understand your questions on some occasions. The shadow health patients do not have a working memory, which means that they cannot draw context from the conversation to answer your questions. So because of this, you want to make sure that every question you ask can stand on its own. You want to make sure to review the tips that can all be found underneath the question mark box to the left of the text box in all of our assignments. These tips are also helpful when talking to non-virtual patients, so they're really helpful across the board. I'm going to go through them for you. Number 1, use correct grammar and spelling. Number 2, avoid pronouns. Number 3, avoid jargon and abbreviations. Number 4, give context when asking questions. Number 5, avoid sentence fragments. Number 6, ask about one subject at a time. And finally, remember to use those educate and empathize tabs. I am not performing a complete patient interview, but rather just demonstrating how I would begin each section of the health history. So let's move on to the next thing, which would be the past medical history. The past medical history, sometimes abbreviated as PMH, is the total sum of the patient's health status prior to the presenting problem. You want to ask about pre-existing medical conditions, prior hospitalizations, medications, allergies, and immunizations. At this point, I want to call your attention to our interview guide feature. The interview guide is an optional feature your instructor can choose to enable or disable. The interview guide, if enabled, will appear on the left-hand side of your screen and will provide you with real-time feedback on your interview progress. As we go through this section, watch how the number of findings discovered increases. Do you have any other medical conditions?
I mean, I have asthma and diabetes, but right now I just care about my foot.
All right, let's just take a minute to briefly empathize with Ms. Jones again before we move on. I'm sorry you're in so much pain. I will get you pain medication as soon as possible.
Thanks a lot.
Okay, let's continue on with our interview. Let's start getting more information on her diabetes diagnosis. When were you diagnosed with diabetes?
I was diagnosed when I was 24.
How are you managing your diabetes?
I try to stay active and avoid sugar, and that seems to be working well. I feel better now than when I was taking diabetes medication.
Do you take any diabetes medication?
No, I don't take anything for my diabetes anymore.
Why did you stop taking your diabetes medication?
I just got sick of dealing with it.
Are you monitoring your blood glucose?
I have a monitor at home, but to be honest, I don't really use it that often.
All right, so you can see Ms. Jones will require some education regarding the proper care of her diabetes when you are conducting your assessment. You would then want to continue asking about her symptoms such as thirst and urinary frequency, weight changes, and diet. You would then go through and ask questions that would enable you to get a full understanding of her asthma and its management. You'll then need to move on to asking about allergies and immunizations. You have to be specific to make sure you're getting the whole picture. So let's go ahead and ask a few questions. Have you had all of your childhood immunizations?
I'm pretty sure I received all my vaccines as a kid, like before registering for school.
All right, now let's get a little bit more specific. Have you received your flu vaccine?
No.
All right, you could provide some education here for sure. Because of the nature of Ms. Jones' injury, we should also specifically ask about a tetanus shot to make sure she doesn't need to get one. When was your last tetanus shot?
I got a tetanus booster about a year ago.
Finally, you need to ask about all of her home medication use. Do you take any medications at home?
I don't take anything, unless my inhaler counts.
That definitely counts. You will need to get some more information on that while you're doing your assessment. Finally, don't forget to ask about any non-prescription medications as well. Do you take any over-the-counter medications?
I take Tylenol for a headache sometimes, or Advil for cramps, but not often.
All right, I think you get the feel for the past medical history section of our health history. We can move on to the social history. A social history is a portion of the medical history addressing occupational and recreational aspects of the patient's personal life that have the potential to be clinically significant. In this section, you're going to ask about the patient's level of education, who they live with, religious views, and recreational drug, alcohol, and tobacco use. Let's go through a couple of the trickier ones. Have you ever smoked cigarettes?
No, I think it's gross.
Remember to be specific so you're getting all of the information from the patient. Have you ever smoked marijuana?
Well, I used to smoke pot, but I don't do that anymore.
All right, let's ask about other drug use. Have you ever used any other drugs?
No.
And now we can practice quantifying alcohol use. Do you drink alcohol?
I do sometimes, yeah, when I go out with my friends.
How often do you drink alcohol?
No more than once or twice a week, sometimes less.
All right, let's move on to the family history. A family medical history provides insight into the conditions that are common in the patient's family. This history can be used to understand the risk of a patient getting certain familial linked diseases such as heart disease, diabetes, and some kinds of cancer. The family medical history is a record of illnesses and medical conditions affecting your immediate family members and generally should include 3 generations to provide a complete picture. Let's ask her about diabetes since we already know she has that. Does anyone else in your family have diabetes?
Dad has sugar diabetes, and I think my Grandpa Jones did too.
Okay, so we can note that both Tina's father and paternal grandfather have diabetes. Let's ask about her mom. Does your mom have diabetes?
She doesn't have diabetes. It was Dad who had it.
I don't feel like I completely understand enough to chart yet, so I'm going to ask one more clarifying question. Do all of your grandparents have diabetes?
Grandpa Jones is the only one of my grandparents that had diabetes.
Okay, I think we now have a clear understanding about who in those 3 generations is diabetic. You would continue on with the family history. Don't forget to ask about her brother and sister as well. A review of systems will help to elicit a full medical history from a patient. Most of the answers to the questions that you're asking will be no, but it's important to go through the entire inventory to ensure that nothing is missed and you're going to get the complete medical picture. So go through each of the body systems. I like to start from the top and work my way down, meaning start with the head and work my way down to the toes. Do you ever get headaches?
Yeah, I get them a lot when I'm studying.
Do you have ear pain?
My ears are fine.
Do you have any vision problems?
I've actually been noticing problems lately. When I'm reading or studying, I'll notice that things start to get kind of blurry.
All right, so she's definitely telling us some things that we're going to need to address. Make sure to document all of this before moving on to the rest of the review of systems. Don't forget to also ask about mental health and women's productive health.
Hi, I'm Preceptor Diana. I'll explain the details of this assignment and your objectives, just as a preceptor would in real life. Pay close attention to this information, as it will help guide your exam. At the end of this pre-brief, you'll answer a short question about the upcoming assignment. During the simulation, you may return to these instructions at any time by scrolling to the top of your transcript. Your patient is Tina Jones, a 28-year-old African-American woman who has just been admitted to Shadow General Hospital for a painful foot wound. Your role in this simulation is that of a healthcare provider who will take Ms. Jones' health history, a key component of her admission process. A health history requires you to ask questions related to Ms. Jones' past and present health, from her current foot wound to her pre-existing conditions. You will also want to review Ms. Jones' systems, psychosocial history, and family medical history. These assessments together will give you a comprehensive picture of Ms. Jones' overall health. If you discover any disease states, ask about symptoms and the patient's experiences of them. Your questioning should cover a broad array of the symptoms' characteristics. Throughout the conversation, you should educate and empathize with Ms. Jones when appropriate to increase her health literacy and sense of well-being. Regardless of whether you have assessed Ms. Jones previously, ask all questions that are necessary for obtaining a complete health history. While you should communicate with patients using accessible, everyday language, it is standard practice to use professional medical terminology everywhere else, such as in documenting physical findings and nursing notes. You may complete the exam activities in any order and move between them as needed. You will complete nursing tasks to protect the patient's safety, privacy, and health. You can document your findings, including vital signs, in the electronic health record. This record provides necessary information for healthcare professionals who will continue patient care. You will then move on to the care plan activity, in which you will synthesize your subjective and objective data to complete the nursing process. You will develop a nursing diagnosis for Ms. Jones' condition. Identify a treatment goal, plan your interventions and evaluations, and finally, assess if your goal was achieved. The care plan is just as important as your assessment, and the patient's well-being will be greatly affected by your diagnosis and interventions. The activities evaluated by the simulation are subjective data collection, education and empathy, and the care plan activity. Nursing tasks and documentation, while they provide valuable practice for their real-world counterparts, are not automatically evaluated by the simulation. Your success in education and empathy is based on whether you promptly respond after identifying a moment worthy of therapeutic communication. The evaluation of your interview is dependent on how you word your questions therapeutically and precisely and explore all relevant topics with comprehensive breadth and depth. Your success in the care plan activity is based on whether you accurately identify Ms. Jones' nursing diagnosis, select a goal most immediately beneficial to her, Select and prioritize the most effective treatments and accurately evaluate your results. The care plan will make up a significant part of your grade, so be sure to carefully choose your answers based on evidence. This assignment takes on average between 90 and 110 minutes. This exam may take longer than in real life because in this safe simulation, learners of all experience levels can take time to hone and review their skills. You can pause and resume the assignment at any time. Your work is always saved automatically. In this assessment, you will familiarize yourself with the structure and content of a health history exam so that with real-life patients you can ask effective and comprehensive questions, obtain a thorough health history, evaluate the patient's risk of disease, infection, injury, and complications, educate and empathize, develop a nursing diagnosis, create an effective and expedient care plan, and evaluate your results to determine your goal's achievement. In 1 or 2 sentences, answer this question to help prepare for the upcoming exam. Why is it important to obtain a patient's complete health history? Time to begin. This tutorial will guide you through the 4 pre-exam privacy and safety checks that must be completed every time you enter your patient's room. If you would like to skip this tutorial, click the Close button. Otherwise, go ahead and greet your patient by typing a brief introduction into the communication box below.
Hello.
As a nurse, it is your job to protect your patient's confidential information and dignity. Before you begin an exam, you should always pull the curtain closed to ensure your patient's privacy. Click Nursing Tasks on the exam menu, select Privacy, and then close curtain. The curtain you just closed has been touched by many people and is rarely cleaned. Privacy curtains are just one of many possible contamination sources in a hospital setting. Before starting an exam, it is imperative that you wash your hands. Return to the Nursing Tasks menu, click the Infection Control button, and then select Wash Hands. Finally, proper identification is critical for the safety of your patient. To protect your patient, you must confirm their identity in two ways. First, check your patient's armband. Return to the Nursing Tasks menu, click Safety, and then select Patient Armband. After you have checked your patient's armband, ask can you confirm your name and wait for the answer. Use the communication box to ask this question now.
Tina Jones.
Well done! You have completed the pre-exam safety tutorial. Remember to perform these actions every time you enter your patient's room. There are also safety tasks to perform before you leave the room. You will be asked if you would like to complete the post-exam safety tutorial when you click the End Exam button. Click End Tutorial to continue your exam.
I got this scrape on my foot a while ago, and it got really infected. It's killing me. Thanks a lot. I was changing a light bulb, and I had to use our little step stool to reach it. My foot slid off the bottom step, and it got all scraped up. I didn't realize how sharp the edge was. I've had asthma since I was little, and I have sugar diabetes. My doctor told me when I was pretty little, I think it was about 2.5. I used to have a lot of trouble with asthma attacks back then. It's just a regular Preventil inhale. I was diagnosed when I was 24. I don't take medicine for it anymore. I just got sick of dealing. I don't know the number. The ER nurse just said it was high. Honestly, I have trouble figuring out what the numbers. I'm not crazy about being here, but I really want my foot to heal up and get back to my life. I got a tetanus booster for work about a year ago. For the other kinds, I got all the required ones when I was a kid, and for college. I'm sure I have a record somewhere. No, I think it's gross. My baby sister has asthma like me, but she's pretty healthy. She almost never has trouble with it. Dad has sugar diabetes, and I think my grandpa Jones did too. Um, I don't think so. Like a 7. It hurts a lot, but whatever pain med the ER gave me is helping a little. Well, I got the scrape a week ago, but the scrape and the pain got a lot worse in the last few days. It feels like the pain is just centered around the scrape, like around the ball of my foot. That's where it hurts the most, but my whole foot feels some pain. It's throbbing and like sharp if I try to put weight on it. I mean, it's all red and swollen, and there's pus. It feels hot. It hurts like hell. It's got all that going. The pain's worse in my foot, but I feel it moving up into my ankle too. Putting my foot up helps a little, I guess. But the only thing that makes a real difference is the pain pill. Yeah, I'm allergic to cats. You know, I did notice lately that I've been really thirsty. My appetite's been huge lately. I feel like I'm hungry all the time. Well, in the past month, I've lost some weight. I'd say about 10 pounds. I've actually lost a little weight recently. I don't know what caused it. I just lost. It's really rare for me to have an attack now. 3 days ago, I had some breathing problems, but I guess probably my last full attack was in high school. I got this scrape on my foot a while ago, and it got really infected. It's killing. Yeah, I'm allergic to penicillin. It was a long time ago, so I don't remember that well, but I don't think it was that serious. I just got a rash, like hives, I think. Then the doctor said not to take penicillin again, so I... Nope. No food allergies that I know. Well, before this, I went a bunch of times when I was little for asthma attacks. This is the first time I've been in the hospital since I was probably 16, though. My chest and throat get tight, and I start to wheeze. It feels like I can't take in air, like I can't get enough air into my lungs. Yeah, I took Advil at home, and then the ER gave me... Being around cats is the worst, but dust and running upstairs can make my breathing bad. It helps for a few hours, but it never makes the pain go completely. I don't know, every hour or two when I'm awake. Whenever I'm around cats, I start sneezing, my eyes get itchy, and my asthma. Well, I don't know if it's allergies, but sometimes my asthma acts up around. Yeah, we go to First Baptist, and we do a lot with our church community. Even before a service, it's pretty social. We go early so we can meet and talk with everybody. And I go to the Wednesday night Bible study group. There's other events too, potlucks, all of that. Oh, and once a month the church organizes like a volunteer event. so I try to do that. We spend a lot of time with our church family. Well, I'm finishing up my bachelor's degree right Right now. I live back at home with my mom and my I don't get stressed out much, but sometimes having a hectic schedule can be a lot. Right now, though, I'm mostly worried about. I've never been in any kind of situation like that. It's scary to think about. Well, I used to smoke pot, but I don't do that. I do sometimes, yeah, when I go out with my friends. No, I really try to avoid people who are smoking. I think it's gross. I mean, the last few days I couldn't walk on my foot, so it's gotten in the way of everything. I had to basically stay home and off my foot. I didn't think it could get to the point where it caused so many problems. Yeah, there's definitely. I just watch what I eat and try to stay away from. I made sure to clean it and just keep it bandaged. And I put Neil's. Well, I'm here, so I guess it didn't do its job. Well, I used to smoke pot, but I don't do that.
Well, Mom's doing pretty good, but Dad passed away last year.
Thanks.
He died in a car accident.
I appreciate that. Yeah, I think they all had some.
I have two, a brother and my little sister. No, I don't think so. He's a little big. She's pretty healthy. She has asthma, but almost never has it.
One person in the family, my dad's brother, has an alcohol problem, but we've got high blood pressure in our family for sure. Granny, Mom, and Dad had it. And honestly, I think my other 3 grandparents might have had issues with that too.
No, not that I know.
Now that time has gone by and I've had a chance to grieve, I feel like I'm coping really well. Church helps, and talking about Dad with my family. I'm at peace with it now, knowing he's It seemed like
Well, I guess I was noticing the other day that the skin around my neck is looking weird. Like the skin is getting darker. And my skin's breaking out. But that's how it is. Maybe I need to stretch a little when I get out of bed, but nothing.
I've actually been noticing problems lately. When I'm reading or studying, I'll notice that things start to get. No, I. It's the normal brown, I guess. I've never noticed any weird. Nope. Yeah, it's super painful. I can't stand the thought of anyone touching. It doesn't feel tender at all. It's type 2. I took Advil at home, and the ER gave me some. I started taking Advil 2 days ago.
Nope, no surgeries. I've been lucky.
Well, before this, I went a bunch of times when I was little for asthma attacks. This is the first time I've been in the hospital since I was probably 16, though. Yep, I'm definitely in pain. Makes sense. The pain medication worked before. It works for me. Cool.
The respiratory exam is an interview and physical assessment that is performed when a patient presents with a respiratory problem or a history that is suggestive of a pathology of the lungs. You will be conducting a complete respiratory assessment on Ms. Jones because she has a history of asthma. Her asthma will be the major focus in this assessment, but you will also need to cover a targeted review of systems and her family history related to the respiratory system. We need to begin by making sure we get a full picture of Ms. Jones' asthma history. Let's start off by asking her, when were you diagnosed with asthma?
My doctor told me when I was pretty little. I think it was about 2.5. I used to have a lot of trouble with asthma attacks back then.
And then we can sort of fill in the details and get more personal with her and ask questions like, what does it feel like when you have an asthma attack?
I haven't had an asthma attack in a while, but I used to get them growing up, and my chest would feel really tight, like I couldn't take in air, and I would wheeze really bad and get all sweaty. It was way worse than
Many
now,
students forget to
especially
include
because
asking
I
about
would
any
use my
current
inhaler and it
symptoms,
wouldn't
such as
help.
coughing
It
with
was really
exertion and
scary.
without, asthma triggers, and chest pain. So be sure to include those too. Make sure you also include asking about tobacco as well as marijuana use, as both are inhaled into the lungs and can be damaging, especially with a person for asthma, as it can cause and contribute to asthma exacerbations. I highly recommend utilizing the Respiratory Concept Lab and reviewing what are normal and abnormal lung sounds before completing this assessment. It will be easier to identify what you are hearing. I'm going to go ahead and let you get started.
Hi, I'm Preceptor Diana. I'll explain the details of this assignment and your objectives, just as a preceptor would in real life. Pay close attention to this information, as it will help guide your exam. At the end of this pre-brief, you'll answer a short question about the upcoming assignment. During the simulation, you may return to these instructions at any time by scrolling to the top of your transcript. It's noon on Tina Jones' first day as a patient here at Shadow General Hospital. Your role in this simulation is that of a healthcare provider who will perform a full respiratory exam on Ms. Jones, given her history of asthma. In your interview with Ms. Jones, you will ask about her respiratory system and identify any risk factors so that you can determine any current and potential issues. If you discover any disease states, ask about symptoms and the patient's experiences of them. Your questioning should cover a broad array of the symptoms' characteristics. You will also inquire into the health history of Ms. Jones' family with regards to the respiratory system, so you can determine her genetic predisposition to any diseases. Regardless of whether you have assessed Tina previously, ask all questions that are medically relevant to her respiratory system. In addition to collecting subjective data, you will perform a physical exam on Ms. Jones' respiratory system to gather objective data about the system's health and physiology. While you should communicate with patients using accessible everyday language, it is standard practice to use professional medical terminology everywhere else, such as in documenting physical findings and nursing notes. You may complete the exam activities in any order and move between them as needed. You will complete nursing tasks to protect the patient's safety, privacy, and health. You can document your findings, including vital signs, in the electronic health record. This record provides necessary information for healthcare professionals who will continue patient care. Activities other than subjective and objective data collection, such as documentation and education and empathy, provide valuable practice for their real-world counterparts. However, they are not automatically graded by the simulation. In this assignment, you will be evaluated on your subjective and objective data collection. The evaluation of your interview is dependent on how you word your questions therapeutically and precisely, and explore all relevant topics with comprehensive breadth and depth. The evaluation of your physical exam is based on how successfully you report on your physical findings by selecting among clinical terms in the electronic health record. This assignment takes on average between 40 and 50 minutes. You can pause and resume the assignment at any time. Your work is always saved automatically. In this assessment, you will become familiarized with the structure and content of respiratory exams, so that with real-life patients you can ask effective and comprehensive questions, use therapeutic language, evaluate the patient's risk of disease, infection, injury, and complications, and obtain and assess objective data. In 1 or 2 sentences, answer this question to help prepare for the upcoming exam. Based on your current knowledge, explain the pathophysiology of asthma. Time to begin. This tutorial will guide you through the 4 pre-exam privacy and safety checks that must be completed every time you enter your patient's room. If you would like to skip this tutorial, click the Close button.
Hi. I don't like dwelling on my weight. I've always been kind of heavy set, but that's just the way my body is. I don't like stressing about it. Right now, it's about a 6 out of 10, I'd say. The pain pill helped. It's gotten up to about a 9 or 10, though since I've been here, it hasn't been that bad. Right before I took the pain pill, it was probably at an 8 out of 10.
No, I don't think so.
I have breathing problems sometimes, yeah, but I haven't had a full attack in years. I can My breathing's fine right now, but I do have asthma.
$99. $99. $99. $99. $99. $99. 99.
No, it never hurts to breathe. Maybe my chest gets a little. Just when I have breathing problems, like I can't take in air. It's just me and my baby sister that have asthma, but she really doesn't have problems with it. Being around cats is the worst, but dust and running upstairs can make my breathing bad too. It's just a regular Preventil inhale. I haven't had a full attack in years, but I have trouble breathing sometimes. It's really rare for me to have an attack now. 3 days ago, I had some breathing problems, but I guess probably my last full attack was in high school. I try to avoid things that give me breathing problems, but when my asthma starts to act up, I just use my inhaler. I don't get colds or cough much.
I haven't been coughing. No, I think it's gross.
Yeah, I'm allergic to cats. I saw Dr. DeWitt for my asthma starting when I was diagnosed, but she moved away about 2 years ago. No, just the asthma.
Yeah, I've done that before. In high school and after high school. I definitely don't anymore, though.
No, I really try to avoid people who are smoking. I think it's gross. I really try to stay away from cats, but when I'm around them and my asthma acts up, I use my inhaler.
No, nobody at home smokes.
The only cancer that I know of in our family is colon cancer. Grandpa Jones died of that. My baby sister has asthma too, but no one else in the family has lung problems. I don't. They were fine, I guess. I don't really remember much. I was pretty young. They were fine, I guess. I don't really remember much. I was pretty young. I've never had heart problems, thank God. I've been. No one's ever told me I have high blood pressure before.